Welcome. My name is Melanie Winters. I'm a licensed clinical social worker and navigator at Kandu Health. I am presenting on our poster, which explored whether a telehealth-based program can support survivors with varying SDOH needs following discharge, and if by addressing those inequities, we can reduce readmissions and improve patients' health outcomes. Our study looked at 50 survivors who were participating in Kandu, a tech-enabled, survivor-centric, navigator-led support program that in the initial onboarding call utilized the CMS SDOH screening tool, as well as screening throughout the 12-week program for SDOH needs that were then addressed. We utilized pre-populated resource maps provided by our hospital partners, which we then supplemented to address any additional survivor needs, as well as survivor needs for those that are located 3 to 4 hours away from their stroke center. Our studies found that 32% of the survivors identified mental health as an SDOH need. We know that 1 in 3 survivors have depression, and by addressing anxiety and depression, we can improve not only their quality of life, but also improve their performance in rehab. 26% identified financial strain, and we know that survivors can't take their medications if they can't afford them. And it can help also with getting them durable medical equipment because they can't monitor their blood pressure or their blood sugar if they don't have the appropriate DMEs. And 20% identified transportation. And if they can't get to their follow-up appointments, that's a problem as well. We found a direct connection between the SDOH needs and the navigator time. With the more SDOH needs identified, the longer one-on-one direct navigator time the survivor received. By assessing social determinants of health for our stroke survivors as a barrier to their recovery, and then addressing those needs on a survivor-specific basis, Kandu may be able to improve health outcomes for our survivors, as we have found in our 50 survivor study. Additional post-acute stroke care and programming is needed to address the ongoing inequalities and inequities in the healthcare system as they relate to post-stroke recovery and subsequent stroke prevention in survivors with high SDOH needs.